Hey, what's going on? It's Mehl. I'm here at Crossfit Horsepower with Miss Danielle Lee, and this is episode 1 for fixing your squat and fixing your lower leg, foot, ankle, calf. So the first thing you're going to want to do before figuring out how to fix your body is you want to test your squat and see what's going on. See what muscles are tight, see where you feel pain or any limitation or restriction, and that way you can address what needs to be addressed. So I'm going to have Danielle do a couple squats here, and what I want you to look at is I want you to look at her feet, her ankles, and her lower leg below the knee. Go ahead. Good. So now we're going to have her do one slowly, and I'm going to point out something to you so you can see this, because this might be something you're dealing with or something you have always been curious about. So if Danielle starts with her feet straight and she goes into a squat, go ahead. You can see her feet start to turn out. So what a dead giveaway is that there's hips are tight, the tibialis is tight, the calf muscles are tight, and that's causing that internal rotation, because when you want to squat and when you want to generate power, you need external rotation of the hips to create torque, right? So the classic cue you hear a lot is knees out, and what that means is by driving the knees out, we're trying to open up the hips so they can sit down and get proper depth, so your torso can stay upright so you can have a strong, powerful squat. If you're missing that because of tightness, you're going to start seeing this happen. The knee is going to become valgus, which means rotate inwards, and you're at risk for injury or poor performance, and we don't want either of that. So the first exercise I'm going to have Danielle go through to mobilize the ankle is a really simple exercise that's right behind us right here, which is a jump stretch band, and you can use a multitude of resistance or colors, and we choose a thick one here, and the reason why is we want to create separation in the front of the ankle so we can get good dorsiflexion of the foot. So I'm going to have her bring her right foot in here first. It's going to go right around the front of the ankle above the tongue of the sneaker here, and she's going to walk that foot out as far as she can until she gets pulled back by the band and has the most resistance possible. This back foot is flat behind her, and what she's going to do is, her goal here is to try to keep this whole foot down, and she's going to drive her knee over her toe and then come all the way back. So she's going to do about 10 on each side, and what this is doing is it's creating space in the front of the ankle to allow her to get a better depth in her squat and not have that foot externally rotate. So what you want to do, you want to do about 2 sets of 10 to 15 on each side, and then one of the greatest tools that we have at our disposal that's very cheap, it's about $1.99, is the lacrosse ball. And what you can do with this is break up muscle adhesions or knots and provide better movement for your tissues and for your joints. So because Danielle's calves are tight, that's why you're seeing a lot of tightness in the hip and the lower leg dysfunction. So now that she's done that band exercise to loosen up the front of the ankle, one of the best calf exercises for mobility and to improve mobility is the laying down calf smasher, we'll call it, right? Okay, so what Danielle's going to do is she's going to take the ball and she's going to lay down on her back right here. Okay, she's going to bring her leg straight up in the air. Okay, so you can see. So she'll bring her left leg straight up in the air. Good. And she's going to put this ball right behind the back of her knee in the upper outside part of her calf like this. And all she's going to do is bend that knee, and then she's going to hug her shin. So this way, all she has to do is relax, lay down, and it's an easy position to get into the top of that calf. So once she finds a spot that's tight, if you watch her foot, she's going to start dorsiflexing and plantar flexing. Just like this, back and forth about 15 times. That's really going to wake up the calf and get that muscle to relax and release and provide for a better squat. Once you've done 10 to 15, about 2 sets, you can start moving the foot internally and externally and get all of that calf muscle to wake up and help provide better movement. And the third exercise for your calf and for your tibialis, which is the front part of that shin, it's always going to get fired up from the Olympic lifts, from box jumps, from 90% of your CrossFit movements, is we're going to put the foam roller on the ground and Danielle's going to lay down with her shins on top of it in an X pattern. So I'm going to have her do that. And as you can see, she's got the front upper part of her shin on the foam roller, and she's going to move her body up until she feels a spot that's tight. Once she feels a spot that's tight, she's going to shift her weight like she has right here to the left, and she's going to start flexing that toe up and down and taking her foot through a full range of motion to really get into that tibialis in the front of the shin. So you're going to do this for about 1 minute to 2 minutes, depending on how long it takes you to get that area to loosen up. Okay, so the final exercise that I'm going to show you today is an advanced move that I call bulletproofing your ankles. I've had many ankle and foot injuries in my life, and the only reason I've been able to come back from them is by doing these exercises I've shown you on a consistent basis and incorporating some dynamic movements as well. So this exercise is a dynamic movement that you should do very slowly with caution. So what you want to do is you want to turn your foot so your heel is out and pointing the sole of your shoe this way, and then you're going to step and walk on the outside part of your foot slowly, driving the ankle bone down. What this is going to do is this is going to stretch out the perennial, which is the outside part of the calf, and that tibialis that we've been working on. So by doing this, not only will it make your ankle ligaments and your foot ligaments stronger, but this will also stretch those muscles that are overworked and long or weak. So obviously do this with caution. Make sure that every step is not painful. If you feel a sharp pain or a pinch in the foot or ankle, I want you to stop immediately. Thanks for checking this out. Next week we're going to have part 2 of our series, which is we're going to work on the knee, making sure that knee doesn't collapse in a squat, how to protect your knee, how to keep the quads strong and healthy, and also your hip range of motion and mobility. Thanks.